Hematology Oncology Overview of Hemolytic Anemias. So before we enter the hemolytic anemias, I think it would be important just to do kind of an overview audio of what hemolytic anemias mean and how they are further classified, because there's so many of them and they classify them differently just based off of what happens in each of the pathologies. So the way that I like to look at it is twofold. The first thing that I look for is whether it's occurring intravascular or extravascular. So whether the hemolytic anemia, whether the lysing of the red blood cells, it's all that hemolytic anemia means. It just means that we're breaking red blood cells. If it's occurring within our vasculature, within those blood vessels, or outside due to something else, okay? Extravascular. So that's just the location in which hemolytic anemia occurs. Another way to look at it, and another way that they split it up, is via intrinsic hemolytic anemias versus extrinsic hemolytic anemias. And that means in regards to the red blood cell. So is it intrinsic to the red blood cell? Is it due to something that's going on with the red blood cell? Or is it due to something that's going on outside of the red blood cell that the red blood cell cannot help change? Okay. Now, with all hemolytic anemias, for example, intravascular hemolysis, okay, so this is within our blood vessels, the breaking of red blood cells, there's going to be some key findings that we need to understand. We're going to see a decrease in haptoglobin. And haptoglobin, all that it is that it's this molecule that floats around in our serum. And what it will do is that it will bind any free hemoglobin that it finds in the serum. So if we have hemolysis, red blood cells, once again, carry hemoglobin. If that red blood cell lyses, then it's going to leak out all the hemoglobin into the serum. So we have this molecule known as haptoglobin, which can bind hemoglobin and take it away to the kidney so that we can get it out of our system. Okay, but what happens now, since we're binding up all the hemoglobin due to the lysed red blood cells, our haptoglobin level drops. And so that's the first thing that we have to understand that occurs with any type of intravascular hemolysis. Another thing that we're going to be seeing is schistocytes on blood smear, right? Since we're lysing these red blood cells on our blood smear, you're going to see these torn apart red blood cells, which is really important for you to understand. The main characteristics that you're going to be seeing for patients that are going to be presenting with, they're going to have hemoglobinuria. Okay, so hemoglobin is going to be in the urine, as well as homocystinuria, which is just these sloughed off cells from the kidney due to the fact that we have buildup of iron and hemoglobin in those cells, and they start to die off, and then that's known as hemocystinuria. Or another thing could be urobilinogen okay? So urobilinogen in the urine. Now, extravascular hemolysis, on the other hand, to contrast, this is due to the fact that there's macrophages in the spleen that clear the red blood cells. So we're not lysing the red blood cells within the vasculature, within the blood vessels. We're actually just taking them out via the splenic macrophages, okay? This can lead to splenomegaly due to the fact that we're overworking the spleen because we're trying to clear any abnormal red blood cells, okay? And we're going to get into the specifics of what causes each one of these later on. But I want you to just pay attention to the difference between now intrinsic versus extrinsic. Intrinsic hemolytic anemias are going to be due to the fact that there's something wrong with the red blood cell itself. Something's going on intrinsically when looking at it from a point of view of the red blood cell. Extrinsic hemolytic anemias are secondary to something outside of the red blood cell's control. It's not due to an abnormality of the red blood cell. It's due to something outside. Okay, we're going to dive into it for the next video.